Hello students, I am Padmaja from Center for Health Psychology, University of Hyderabad. I am here to talk to you about group counselling today. We have been discussing about various types of counselling. Let us first start off with the objectives of today's program. To introduce the student to the concept of group counselling, to have a brief glimpse of the emergence of group counselling and its history, to visit the processes in group counselling, to discuss the factors of group counselling, to list out the stages in group counselling, to provide a brief introduction to the techniques used in group counselling. Let me first introduce you to the concept of group counselling and how it is done. Group counselling involves a small group of people, usually 6 to 10 of them, who meet together every week or depending upon the intensity of the program at regular time intervals, along with 1 or 2 trained members who act as facilitators, and they together talk about the struggles and problems. The group can take a variety of forms. Some can focus on specific topic or a problem, while others address a number of different concerns. It involves members who come together, forming their own specific goals. They may share their own problems which they think are the major concerns for them, and in the process there is empathy which is provided and support to each other. And also in turn they try to change their what is called self-defeating behaviors. The group members are also assisted in developing their existing skills in dealing with interpersonal problems. The broader concept of group counselling can be taken to include a helping process which takes place in a group, including support groups, skill training groups like anger management, assertiveness training, relaxation training, social skills training and various other training groups, and also psycho-education groups. Sometimes more specialized forms of group counselling may be included. Non-verbal expressive therapies like dance therapy, music therapy. How would the composition of the group be? There may be groups with a composition, small composition, let us say 6 to 10 people, or they may be medium, about 15 to 30 people, or they may be large, 30 and above, maybe up to 70 at times. They may be open groups, they may be closed groups, and the sessions in turn may be brief, which means about 8 to 16 sessions on the whole, or it may be a medium range like 12 to 18 sessions, or it can be long range which may even last up to years, like 3 years sometimes. Gender may be mixed or single. Age range may vary or may be uniform, and the ethnic backgrounds and problems may also vary, or sometimes similar problems and similar ethnic backgrounds may also come together. There may be a variation in all these in terms of the composition of the group. The groups may be therapy groups, they may aim at therapy, psychotherapy, they may be self-help groups, they may be support groups, they may be educational groups, or they may be what are called encounter groups, which we are going to discuss shortly. What does group counselling do? Group counselling provides an opportunity for members to observe how their behavior affects other people and also to receive personally relevant feedback from the group members. It maximizes the likelihood that this will happen because the counselors are there as facilitators, as catalysts, as helpers out there in the group session. They often emphasize not only that the members reveal themselves, whatever they want to talk about themselves, but also they encourage the group, the whole group, the composition of the group to react to what is said in the group setting. Let us now talk about the emergence of group counselling. Treatment of patients in groups has received a great deal of emphasis in the military during World War II, where psychotherapists were in short supply. Large number of people had to be given therapy or given counseling, whereas the number of people who would support them in terms of counseling and psychotherapy were short. Numbers were less. Found to be effective in dealing with a variety of problems, a large number of problems, and group therapy thus rapidly became an important therapeutic approach in civilian life as well. What started off with the military setting has slowly expanded itself to be included in the civilian life as well. This experience of group therapy need not be the same for everyone. It may vary with people, it may differ from person to person, and this difference that the people experience may be based upon the types of problems that they are facing or the disorders which they are confronting. Different group members may be facing different variety of problems, and each person may look at the therapy in a different way. The therapeutic goals which are established for individual member as individual member perceives it, the role that the leader takes, the setting in which the group meets, and also the individual characteristics of the group members. Participants are usually screened before being admitted into the therapeutic group or the counseling group, so as to ensure that they will be able to participate at an effective level and that they will not be disruptive to the group as such. Let us now have a brief glimpse of the history of group counseling. Groups certainly have a distinguished history in counseling services. 1905 may be mentioned as a step towards the beginnings of group counseling, where a physician, Joseph Hersey Pratt, found that the time spent together by his group of tubercular outpatients at Massachusetts General Hospital was informative, supportive, and therapeutic. The foundations of group counseling in USA were laid along with Pratt by Trident Burrow and Paul Schilder. All three of them were active and working at the East Coast in first half of the 20th century. These early group efforts were similar to the traditional group guidance. Moreno introduced the term group psychotherapy into counseling literature in the 1920s. After World War II, efforts towards group counseling were done along with Moreno by Samuel Slawson, Hyman Spodnitz, Erwin Yalom, and Lou Ormond. In fact, all the systematic approaches to psychotherapy like psychoanalysis, behaviorism, and others have been applied in group as well as individual settings. In the United Kingdom, group counseling initially developed independently, with pioneers like Fox and Peon using group counseling as an approach to treating combat fatigue in Second World War. They were psychoanalysts and incorporated psychoanalysis into group therapy. Levin's field theory in 1930s and 40s was the basis for Tavistock small study groups in Great Britain and T-group movement in United States. Fritz Perls' Gestalt approach to groups attracted new interest toward importance of awareness and obtaining congruence within oneself. Edward Stemming conceptualized and implemented the idea of quality work groups. William Schutz and Jack Gibb emphasized the humanistic aspect of T groups that focused on personal growth. Rogers devised the basic encounter group in 1960s, which became the model for growth-oriented group approaches. Yalom's approach to group therapy has been very influential not only in USA but across the world through his classic text, The Theory and Practice of Group Psychotherapy. Another recent development in the theory and method of group counseling based on an integration of systems thinking is Agazarian's system-centered approach called SCT. Let us now briefly look at the differences between the individual counseling, which we have been discussing in the other sessions, as against group counseling. The differences and similarities between individual counseling and group counseling. Group counseling, like individual counseling, helps people who would like to improve their ability to cope with problems in their life, just like individual counseling. In individual counseling, the counselor meets with only one client. In group counseling, as the name indicates, there is a whole group which may involve more than one person and more than one counselors too at times. Group counseling aims at helping people learn about themselves and improve their interpersonal skills and relationships as well. During group counseling session, each member expresses their own feelings, their own problems and ideas as well as reactions as freely and as honestly as possible. The group members thus have an opportunity to learn not only about themselves and their own issues, but also the value of helping others, which means the other group members. The theories and the techniques which are used in groups and group counseling are often the same which are employed in individual counseling as well. Of course, there are certain differences in the application, but approaches may be the same. In today's world, there is an increase in the use of the process of group counseling as such in all sectors of the society, and this is not limited to any one particular sector. It includes schools, it includes colleges, the educational setup, the community mental health clinics and setup, and other human service agencies and organizations. Let us have a look at the processes in group counseling. When people come into a group, they tend to interact freely with each other, with other group members, and they tend to recreate those difficulties which they brought into this group counseling along with themselves in the first place. There will be a skilled helper, a skilled facilitator, a counselor who helps them, who directs them sometimes. There is a skilled direction from the counselor's side. And the group on the other hand gives the necessary support. There are alternatives which are looked at, and gently at times there may also be a confrontation to the individual. In this way, the difficulty is resolved. Alternative behaviors are looked at, identified, probed into and learned, and the individual develops new social skills, the ways of reacting to people and how he responds to people, how he understands people, how people understand him as well. It provides a safe environment in which one can experiment with new behavior and improve his or her communication skills and receive feedback from others with similar concerns and similar interests, similar problems too. Opportunities to rehearse or practice these skills in group increase the chances that the participants will actually use these newly acquired skills in their actual life, that is their everyday life. Let us now go into the processes which are involved in group counseling. The first and foremost is self-disclosure, the opportunity to tell the group about one's personal problems and concerns. Acceptance and support, feeling a sense of belongingness and being valued by other group members. Non-clarification, learning that one's problems are neither unique nor more serious than those of other group members. Social learning, being able to relate constructively and adaptively within the group. Vicarious learning, the learning about oneself through the observation of other group members, including the therapist. Self-understanding, finding out about one's behavior in the group setting and the motivation contributing to the behavior. Let us now look at the factors which help groups in counseling. Groups have a number of general advantages in helping individuals. Yelom has characterized a few positive forces which he called as therapeutic factors within groups. For counseling and psychotherapy groups, let us look at these therapeutic factors. Universality, realization that one is not alone, unique or abnormal. The recognition of shared experiences and feelings among group members, and that these may be widespread or universal group concerns, serve to remove a group member's sense of isolation, validate their experiences and raise self-esteem. Altruism is the sharing of experiences and thoughts with others, helping team by giving of oneself, working for the common good. The group is a place where members can help each other, and the experience of being able to give something to another person can lift the members' self-esteem and help develop more adaptive coping styles and interpersonal skills. Installation of hope. In a mixed group that has several members, a member can be inspired and encouraged by another member who has overcome the problems with which they are still struggling. Imparting information. The instruction about mental health, mental illness, and how to deal with a variety of life problems. While this is not strictly speaking a psychotherapeutic process in itself, members often report this is a very helpful technique to learn factual information from other members in the group. Corrective recapitulation of the primary family experience. Reliving early family conflicts and resolving them. Members often unconsciously identify the group therapist or counselor and other group members with their own parents and siblings in a process which is a form of transference. The therapist's interpretation or the counselor's interpretation can help group members gain understanding of the impact of childhood experiences on their personality, and they may learn to avoid unconsciously repeating unhelpful past interactive patterns in their present day relationships. Development of socializing techniques. Interacting with others and learning social skills as well as more about oneself in social situations. The group setting provides a safe and supportive environment for members to take risk by extending their repertoire of interpersonal behavior and improving their skills. Imitative behavior. Modeling positive actions of other group members. One way in which group members can develop social skills is through a modeling process, observing and imitating the therapist and other group members. Group cohesiveness. Bonding with other members of the group. It has been suggested that this is the primary therapeutic factor from which all others flow. A cohesive group is one in which all members feel a sense of belonging, acceptance, and validation. Existential factors. Accepting responsibility for one's life in basic isolation from others, recognizing one's own mortality and the capriciousness of experience. The members learn how to take responsibility for their own life and the consequences of their decisions. Catharsis, experiencing and expressing feelings. It is the experience of relief from emotional distress through the free and uninhibited expression of emotion. Interpersonal learning, gaining insight and correctively working through past experiences. Group members achieve a greater level of self-awareness through the process of interacting with others in the group who give feedback on the members' behavior and impact of others. Self-understanding. It refers to the achievement of greater levels of insight into the genesis of one's problem and unconscious motivations which underlie one's behavior. The group may also serve as a catalyst to help people realize a want or a need for individual counseling or the accomplishment of a personal goal. Let us now discuss about stages in group counseling. Group counseling is often broken into 4 different or sometimes 5 stages. Tuckman in 1965 has developed a stage model, and this is considered to be the mainstream. He believed that there were 4 stages of group development: forming, storming, norming, and performing. This concept was later expanded to include a 5th stage, the adjourning stage or morning stage. In each stage, certain tasks are performed. Forming stage. In this stage, foundation is usually laid down for what is to come and who will be considered in or out of group deliberation. The members experience anxiety and dependency and talk about non-problematic issues. Storming stage. In the second stage, that is storming, considerable turmoil and conflict usually occur as they do in adolescence. Conflict within the group at this and other times forces group members to make some basic decisions about the degree of independence and interdependence in their relationship with one another. The next stage is the norming stage. It is similar to young adulthood, in which, having survived the storm, the group often generates enthusiasm and cohesion. Goals and ways of working together are decided upon. Performing or the working stage parallels adulthood in a developmental sense. Group members become involved with each other and their individual and collective goals. This is the stage when the group, if it works well, is productive. Morning or termination stage, the group comes to an end and members say goodbye to one another, and group experience members feel either fulfilled or bitter. So in today's session, we have seen what group counseling means. We had a brief glimpse into the emergence of group counseling and its history. We have visited the processes in group counseling. We also went into the stages of group counseling, how groups are formed till the termination of it. In the next session, we will look at the techniques used in group counseling, various modes in which group counseling is used, how groups in action are useful to the society, among others. We will meet in the next session.